Okay, so I want to go into that. So the triad was actually on this sheet here.
Okay.
And I don't know if your camera will be able to pick this up or not.
Yeah,
but I
I'm
just
sure
thought
it
I'd
will.
show this.
Yes.
Okay. So the triad is.
Maybe not the words, but the picture.
Okay, all right, the triad. Okay. From D.D. Palmer explained that he believed that health issues started from 3 different things, the 3 T's.
Okay.
Traumas, toxins, and thought. With it.
Wow.
Okay.
Yes, I got you.
All right, there we go.
And a lot of the trauma comes from the thought.
There you go. All right. So the foundation of health, is slowly grown into, and again, those are the core values, and it's slowly grown into a chemical, mental, and structural triad.
Okay.
So if you think of anything in your past or in your family's past that may have inflicted health issues, they've pretty much affected one of those 3 arenas, being chemistry, maybe like the sheet says, like poor diet, dehydration, pollution, toxic overload, virus, bacterial infections that have wiped people out, or mental side, just home life, stress, work, family, friendships can be stressful at certain points, as well as family.
Absolutely.
It is the holidays coming up.
Absolutely.
It's stressful
for
some
always
people.
Stressful time.
Just responsibilities, finances, marriage, kids, noise pollution, lack of sleep. Lack of sleep is a big indicator why people come in.
Yeah.
So
That's why I'm here today. Lack of sleep.
And so then, chiropractic is more of the foundation of the triad we look at. We try to help these other sides the best we can. We give information. But the structure, we really, if we can build somebody's structure and get that strong, if that was the weaker side, then of course it's going to pull those other 2 down. But if we can build that structure and make that strong, that should help with our overall mental. Just having the thought of, wow, I can go out and play with my kids or be able to run, or it just mentally makes people happy and helps that side. And chemically, reducing inflammation, reducing pain, reducing nerve irritability.
Right,
all those
reducing
things.
stress.
There we go.
So
So the structural side is focusing our posture, getting exercise, just overall allowing people to sleep better, and reducing stress and strain on their spine and their nerves. So that's what we're focusing there with the Triad of Health.
Yes, and I'm glad you mentioned spine, because that was going to be my next question, is what part of the structure. And so I've seen where, you got the chiropractors deal a lot with the spine and the pelvic reason.
Sure.
Yes.
Look what I got here today.
That's right.
All
We've
right.
got visuals for you folks. That's what I'm talking about.
We're bringing it all out today.
We're going to bring them all out. All the toys of the trade.
Okay, sure. Well, let's bring this out here today, and that's one thing with the chiropractic that I wanted to make sure I talked about is, chiropractic is a hands-on approach to health.
Yes.
So we start off with just visualizing. Just simple. So we have 24 movable bones in the spine. We have our sacrum down here, and we have our iliums, both one on each side.
Yeah.
And we have the base of the skull, the occiput, in this area. So you can see there are disc spaces in between the bones. And then this little
lovely cartilage.
There you go. It can wear and tear without proper motion.
Right.
These holes here, in between the vertebrae, one side being the disc, the other side being what we call a facet joint, make up the hole that the nerve comes out. And these nerves are what control all of our muscles, cells, tissues, organs, spleen, glands.
Yes.
So you can see with a lot of inflammation in the facet, having a lot of capsular swelling, degenerative changes within the disc, rotation, it puts a lot of pressure in that whole space there where the nerve comes out of. And that creates a lot of irritation with that nerve. And that irritability is what generally causes a lot of health issues people suffer from.
Who would have thought that just one space could have so much impact on the entire body?
Right. And I was thinking that the other day. I slipped on a shoe when I was taking my dog out for a walk, and it had a little rock in there.
Mm-hmm.
And that one little rock just drove me insane,
Yes.
just drove me nuts, I don't want to say the word, but it bothered me really bad, just trying to walk my dog. It's amazing how one little thing can affect your emotions, your chemistry, everything, from trying to do one task. And can you imagine this nerve, which controls your muscles, your organs, your tissues, and especially the lower lumbar, where 80% of the population at one point or another has a problem
with. Yes.
How much that can create problems in people's daily lives with that. And so, chiropractors, we look at the curvatures of the spine, we palpate, we visualize, we palpate the soft tissues for tone and tenderness, and then we do more of a motion palpation, that we call it, for alignment.
Okay.
And then we also will go a little bit further. We'll assess range of motion between the joints, kind of varying between their norms and what a person would have coming in. And if we're still needing to move a little bit further beyond that point to look for any apparent changes or any subluxations, we'll do an orthopedic test.
Okay.
And orthopedic tests are simply just moving the body into certain positions or putting pressure in certain areas just to see if we can establish any soreness somewhere.
Okay.
Or if there's any extra nerve irritation. There's even some orthopedic tests that look to see if a person's suffering from loss of circulation, which can be a problem too.
Yes.
From those muscles being so tight from nerve impingement.
You know what, I am going, since you were talking about orthopedic testing, I'm gonna backtrack a little bit, because we didn't get into muscle testing, which I have witnessed a lot of different chiropractors utilize. So explain the kind of muscle testing, because I've actually also seen general practitioners use the muscle testing as well, and I think that they don't really explain to the patient what they're doing.
Okay.
And I only knew what it was because I've seen it before.
Okay.
But I don't remember my general practitioner telling me we're doing muscle testing. So, but I know it's utilized in chiropractic use a lot. So why don't we just kind of backtrack
and get into that first?
Yeah.
So what I was explaining here was chiropractic.
Right.
What I went to school for, my training for chiropractic. Muscle testing is more of an applied kinesiology avenue. Again, going into the neurology, it was what tools can we pull out of our bag to figure out how we can help this person.
Right.
And applied kinesiology it's another tool, and so it's just a way of assessing. So in middle 1960s, George Goodhart had a patient come in with a frozen shoulder and palpated around the shoulder and noticed that a couple of the muscles were weaker than normal, and some of them were just really, really tight, trying to overly guard for that weaker muscle.
Yeah.
And he looked at it and he thought, well, there's really not a loss of tissue. There's no atrophy. There wasn't any flaccid kind of tissue. It was still pretty good in tone. So he palpated around and he found a big knot. And so he was checking the muscle and saw that in a couple ranges of motion that it was weak. And so he palpated and he found a big knot in a serratus muscle, actually.
Okay.
So we learned.
And where's that serratus muscle?
Sure. Right. Well, there's an anterior one, which
here
is the one he found,
Okay.
and then also in the back.
And then in the back, like the small of the back.
Right.
Okay, got it.
So almost like a pec minor muscle,
Yes.
that's right above that area, but
Okay.
there's a serratus anicus, they call it, or anterior. So we palpated in there and he found a big knot, and it was making a muscle really tight, restricting the motion in that shoulder.
Okay.
So he went in and started working on that knot, pushing it together, and by pushing it together, relieved that knot in the muscle, and the person was able to bring their shoulder back.
Wow.
And then he brought the arm out and he was testing strengths, and the strength appeared to come back. And so that was what started
The beginning.
AK.
Okay. Yes, and the muscle testing is really cool when you see it, because I swear you think that the people would be acting but they're really not.
It works
You know,
great.
it does. It really works great of when, you know, you're trying to see where the weak muscles are, and you really can't. And I actually tested it out on my own when I was with one of the doctors, and so I was like, okay, I'm gonna try as hard as I can to resist.
Right.
And my hand is still doing this. So as much as I tried to resist, it did.
And looking at the reason, one of the big reasons why muscle testing has had such a hard coming with that is there are, like I said, the Triad of Health. That's just a small portion of what can create a muscle to be weak. And so not all the times if you push a muscle together is that going to make it strong.
Right.
There could be an emotional tie into that. There could be a dehydration tie into that muscle being weak. There are several different windows into the neuraxis that need to be looked into as to why that muscle can be weak. And so that's what was confusing all along, and still is today, because there's always things we need to learn. That's why they call it practice.
Right, exactly. See, there you go. Now we know the secret behind that.
So
it's like when the scientists call a theory.
There we go. All right. So since 1964, just developing over time, there were many times that, you know, it was almost like, let's throw out the books on this. But then a patient would come in and they were just severely suffering, and they had been through everything else and needed something. And they said, hey, we heard that you could do something for us. And so, like Georgia could go to Harvard and say, all right, you go there and do the muscle testing, and he'd say, all right, well, I was frustrated with this, but let's try this anyway. And all of a sudden, voila, it helped. And it was the only thing that helped him.
Wow.
So he's like, well, we got to stay with this. We're really getting something here. And so they developed a coursework over time and a way to become certified. And it's great. I use it today.
This is how we've come up with the applied kinesiology programs now.
and it's been taught to nurses, chiropractors, dentists, medical doctors. Really anybody with a health licensure can go take these courses and learn.
All right.
And it's great. And again, it's not just the muscle that we're looking at, it's windows into the nerve pathways.
Right.
And it's another tool that we can use. Just like x-rays, MRI, they're a tool that we use to help people out, palpating those different things that we can use to help people out. So
to the best you can.
Right.
And the best their body can.
Exactly.
Exactly.
Right.
What are the most symptoms that people come in here for? When
and I saw that question, and
I think I worded
was
it
excited
wrong.
about this. No. Yeah, like what do I look for? You know, I would say loss of function is what people come in for. They don't tell me that up front. They'll say, you know, they have, and that's fine. That's totally fine. You know, most people will say that they're having back pain, they're having shoulder pain. Most people out there, especially if 80% of the population has back pain at one point or another, kind of live with it or find a way to live with it. And so it's just when it gets to a point where they're losing sleep, they're losing the ability to play with their family, they can't go out and play softball anymore with the team. They can't go bowling. I've had people come in and can't go bowling anymore.
Oh, wow.
Sports players who come in, they're nervous about not being able to keep up with their sports team, and so it gets to that point where they're starting to lose function.
Okay.
And so that's what I ask is, you know, we go through a consultation, going through their past history, and it's anything they want to tell me that'll help me with their present condition. So if they don't feel comfortable with certain things right away because I'm a new person, I get that.
So especially like some of the mental health issues, you know, I don't think people would a whole lot of times come in and say, you know, I've been having these the stressors, you know, the loss of jobs or you know, that kind of stuff.
And those things will help me, and eventually I think those things will come out as long as they feel comfortable.
Right.
But that's where it comes from, is our comfort, and so whatever they can feel comfortable telling me, and then we go through a present condition. And present condition is just more so asking about their symptoms. And then what I really want to know also is what is their symptoms keeping them from? Meaning, what can they not do that they want to do? Or what can they not need to do that they need to get doing.
Okay.
I guess that's the best way to say it.
Right.
So, and then when I ask that, the whole picture starts to really come together. And so whenever I learn
I'm
those
seeing
things-
the art.
See the art?
Yeah, I'm seeing the art of this now. I was kind of wondering, but now I'm seeing it in a visual form through the consultation, your explanation of the consultation process. I'm seeing the art form of, let's go in your past, and then we're morphing into this present, and what can you do? What do you want to do? And I see the crafting.
It comes together,
Yes,
right?
yes, I'm seeing it now.
Because I think that's what people really want.
Mhm.
They want to be themselves.
Yes,
Get out there
absolutely.
and have their strength and do what they need and want to do.
Exactly.
So how can
and
we
your
help them
best
with that?
possible self you can be.
Yeah.
So.
So I don't tell them that chiropractic is the all end all. I just explain who I am, how long I've been here, what we look for as far as a subluxation or a misalignment with the spine, how it affects the nerve flow, and just let them know that I'll do my best to see if I can find any kind of functional problem or nerve irritation. And if I find something, I'll let them know what that is, and then it's completely up to them if they want to try to accept any kind of care once they know what I would do to help them.
Right.
I should say that, and then we just go from there. So okay.
Cool. Let's see, what else do I have? Have we covered everything? Because we've already covered what to expect during a consultation.
Okay.
And so let's get to the business aspect of it. How long have you been here in this building?
Okay, in this building, I would say about 7 years.
About 7 years. And before that, did you have a practice somewhere else, or were you?
Right, I came up from Centralia.
Okay.
Originally, went to St. Louis for school and then
Yeah.
came up this way. I did an internship with a friend of mine in Sullivan for
Okay.
about 4 months. Brett's Chiropractic. Yeah, big shout out.
All right.
There you go.
That's right. Shout out to Brett.
Right, there you go. And let's see, and then he helped me to get started into a small practice in Tolono.
Okay.
And I had I did pretty good. I took over for about 3 or 4 other chiropractors that had been there.
Okay.
And I think just most of the people in the community felt that I wasn't going to be there either. And I was new, didn't understand. I was a fighter, wanted to get it going, and I just didn't realize that people didn't want to get started with me because they figured I was going to leave too.
Right.
And so as much as I went out and knocked on doors and told people who I am, people were rightfully so coming up to Champaign to do most of their healthcare.
Okay.
And get their needs done, and that's true. So I found another space on Fox Drive on the north side of Remax for a little while.
Okay.
And then ultimately found this space about 7 years ago. So
All
I've been
right.
happy here. So.
Magnificent, man. Fabulous.
Recently, we've gone through a remodel. We've got all new painting and furniture and everything to keep up with times.
That's right.
So we're pretty excited about that.
Evolutionary process.
Right. Got a new big fish tank so people can see that. Pretty excited. Sticking with the core foundation of subluxation, helping with people with that, getting them back to what they want and need to do. That's what we're about.
All right.
And so as far as upcoming things is we had all this stuff done. We are launching our new website in January.
All
So we
right.
had photos taken. We're having that done. We have a blog
Okay.
at Bowie Chiropractic, WordPress.com.
Okay.
And so if you want to learn more about me personally and my family and what we do in this community, check it out.
Yeah.
It's pretty exciting. And in January, when we have our new website launched, it'll be linked onto that.
Okay.
And so that'll be exciting, be real easy to click on. We have a newsletter that goes out in the mail, so people can keep up there. We got the blog. I do my best to be a part of the community as far as keeping up with health fairs. I try my hardest to find at least once a month.
Okay.
Whether it's a church, whether it's a business, through the park district, big companies, small companies.
All right.
Stay out part of the community.
Yeah.
Do lunch and learns, and so.
And how often do you do the lunch and learns?
Those, I would love to do those more often.
Mhm.
I probably get to those maybe once every 2 or 3 months.
Okay.
They're kind of hard to find,
Mhm.
and so I'm happy to do those. I'd love to come out and talk with your business and community if you like,
All right.
and let them know more about what can help them in their daily life as
Okay.
well. So, and reduce stress. True.
Yeah.
And we do offer a no-charge consult of Val for anybody who is kind of curious, who
Okay.
doesn't really know. They're more than happy to come check it out if they like. Let's see. And as far as like future plans,
Mhm.
I really love the nutritional aspect.
Okay.
And how eating right really helps not only with just your mood and feeling better,
Mhm.
but also how it helps with your hormones.
Yes.
And I'm.
Woo! I know all about that.
And I have tried several different diet plans on myself just
Mhm.
so that I could help others. Really, I've gone through the adrenal diet, the yeast diet.
See, now we're gonna have to talk
paleo
about
diet.
this because I have been trying to
there's-
get some people in, and nutritionists just don't want to come in right now. But I'm really fascinated about these different.
Right,
aspects,
and,
so.
calorie diets, reduced diets.
He's been on all the diets.
You name it. But I did a lot of research online, and
Okay.
really found one where I could lose weight
Mhm.
and have lots of energy.
Oh wow.
And that's what I was missing, was the energy part.
Yes.
So I'm so excited about that. So I'm wanting to put together a class, and I don't know what to call it yet.
Mhm.
Will be held off-site, but that's going to be some future plans I want to put together too.
All right, then see, you'll have to come back when you get the class started off and talk about that as
That'd be
well.
great.
That would be wonderful to have you back in here.
Sure, and just as a little tip is it really comes down to absorption. That's what it comes down to.
Okay.
That I've learned.
All right,
So,
gotcha.
absorption is the big key.
Nutrition
People-
tip, absorption.
I've learned that it's not so much that people don't. It's not so much that they're eating a lot.
Mm-hmm.
It's so much more of the fact that they're not getting the nutrients that they need
Okay.
to suffice their body.
Yes, and I have heard that before.
Yeah.
I think it's the movement is starting to open up and.
Yeah, it's a cleansing, it's
Yeah.
absorption, it's the right things that we
Right.
need at the right time.
The
It's getting,
detoxing.
the enzymes in, the
Yeah.
detoxing, all those things. So, but that's the chemistry side too. the
That's
Triad of
right.
Health.
Exactly.
Yeah,
See,
so
it still all works
we're
together.
working together.
That's right. And that's the art and the philosophy and the structure and all of that wonderful thing that we call chiropractic care.
That's right.
Dr. Bowie,
Yes.
thank you so very much for coming in and participating on this episode of Health and Soulful Being. Give us your website one more time so we know where to go to, and
Sure.
all your contact information, actually.
Oh,
Give us your
okay, sure,
contact
absolutely.
information.
My office, we're located here in Champaign
Yes.
on 1704 South Neal, so it's about a half a block south of where McDonald's is. It's
That's
kind of a
right.
landmark where
Over here by Hardee's.
across the street from Hardee's.
That's right.
The railroad tracks are my backyard, so my website is bowiechiropractic.com,
Okay.
and very simple.
BOWIE.
There you go.
Chiropractic.com.
And again, it will be updated in January. So we're excited
So
about
look
getting
out
it
for
launched.
that.
And we do have our blog,
Yeah.
Bowie Chiropractic at WordPress.com, which is updated. It just has to be tied to the new website. that
All
comes out.
right. Wonderful.
Any more new information that you need as far as content?
That
goes?
is it.
Okay, all right.
So,
Sounds good.
Did we give telephone number?
No, I did not.
Telephone
Okay,
number. How do they contact you here?
Excellent. You guys, feel free to give me a call, 217-359-7702.
7702-359-7702. Area code 217. Bowie Chiropractic. Dr. Kevin Bowie. And I've been saying his name wrong this whole entire time.
I get that.
And I'm so sorry. So, but now I've got it ingrained in my brain. It takes a little bit of processing issues, but We're all good. Bowie Chiropractic, thank you so very much for
Thanks
participating.
for
And
coming.
I look forward to you returning and talking about all the nutrition side
That'll
of
be
things
exciting.
once you get the class taken off.
So excited.
Once again, this is another episode of Health and Soulful Being. You're listening to 90.1 FM WEFT Champaign. And as always, I'm sending out blessings of peace, love, and bliss. Until next time, take care.